Live from downtown Detroit, home of WDIV and Click on Detroit, Local 4 News at noon starts now.
As coronavirus cases and hospitalizations continue to tick upwards, the CDC director says the right step for Michigan is to shut down again. In the meantime, Governor Whitmer tours Eastern Michigan University's vaccination clinic, so we'll have a live report from Ypsilanti coming up in just a minute. But first, after a mostly wet weekend, light showers are continuing to push through our area. The weather, of course, topping our news here at noon. Thank you for joining us. I'm Evrod Kasumi. We want to give you a live look outside through our sky cam there. Kind of a gloomy and downright sad day over Metro Detroit right now. The big question, though, for meteorologist Brandon Rue right now is, will the wet weather continue through the day? Let's get a check of our forecast now with him. Brandon?
The news is not great, Evrod. I mean, it'll be a little on and off. Right now, it's a little more on over most of Metro Detroit, and it's going to be a tough little system to shake loose of, but it will not rain all day. Keep the umbrella handy. Right now, we have middle 50s in all four zones. A little west-northwest wind, 5 to 10. On our way to 62. That is if we can get a couple of hours of drier weather through the later afternoon. And we do expect fewer showers after 4 p.m. Right now, the heavier rains across our extreme north zone are beginning to lighten up, and that is good news. Been a deluge north of I-69. A little closer in, again, yeah, we've got these scattered light, moderate showers pinwheeling around Metro Detroit. There's a system out over the Lake Erie area getting moisture from the Atlantic. So we need this area to shake loose. And again, after 4 p.m., we'll see fewer showers, but won't be rid of them entirely. So your best weapon, if you've got softball, baseball, any kind of outdoor plans this afternoon. The Local Forecasters app. No lightning expected, but showers that could impede your way. All the details of your forecast, all right there. Free, the Local Forecasters app under WDIV in your app store. Evrod?
All right, Brandon, thank you so much. The other big story that we're following for you this afternoon is about the coronavirus. And the CDC director essentially said that the right step for Michigan is to shut down again. Now, this comes after Michigan's COVID cases have risen for the 7th consecutive week, and many hospitals are again overwhelmed. We're going to have more from the CDC in just a moment, but first let's take a closer look at the numbers for you. Right now, the CDC ranks our COVID-19 infection rate as #1 in the country. Not something to be proud of, with 492.1 positive infections per 100,000 people. Now, the state also has the highest number of UK variant cases in the country. We're expecting new case numbers this afternoon. That'll be a 2-day total, Sundays and today's numbers. On the national front, the United States has now passed 31,199,000 coronavirus cases, with more than 562,000 deaths from the virus. Local 4's Rob Maloney now joins us now live with a look at what the governor has to say about the surge. Is there a chance that we would be shutting down again?
Well, in asking the governor precisely that this morning, Evrod, the answer is no, at least for the time being. So let's take a look at the governor as she was out here at Eastern Michigan University with Congresswoman Debbie Dingell, and they were looking at the vaccination site here that's being run by the National Guard, and people with appointments are in here getting their COVID vaccinations. Now, the governor gave a fairly lengthy remark about where she thinks the state is, and it mirrored much what she said on Friday during her press conference with us. And so one of the questions I had for her, knowing that Michigan is now #1 in the nation, and in fact Debbie Dingell said that 9 of the top 10 cities with COVID are right here in the state of Michigan, is there any actual trigger to reinstate previous restrictions? And the governor at this point is saying no to that.
We had to take strong actions to keep people safe. We now know a lot more about this. We now have PPE, we now have testing, we now have vaccines. We each have enough information to do our part, and that's what we're calling on people to do your part. We know that we are at the end of, close to the end of this saga, if we all do our part, and that's why we're going to continue to call on people to do that and not go back to those same kind of protocols because we're in a different moment.
So she says we're in a different moment, and therefore, voluntarily, the state needs to shut itself down, be it high school sports, eating inside a restaurant, or having in-session school. And we've been over much of this. One of the things that the governor did also say is that on Wednesday, when the current restrictions that were put in place by the CDC will be extended, and that includes going back to your office. She says those are extended largely because she knows that she needs to have the flexibility to do that, but that she doesn't envision needing the full 6 months on that. And so that's what she had to say out here today, and gave no indication that shutting down is in her plans anytime soon. Everett, back to you.
All right, even though the experts are advising it, and we know that she's been trying to listen to the experts. Rod, thank you for the update there. City of Detroit now is holding what it calls its Neighborhood Vaccine Week, and there will be 1 or 2 community COVID-19 vaccination sites that are open from 8 a.m. until 5 p.m. That'll be every day this week, so you can go and get your vaccine. Each site will offer the Johnson & Johnson single-dose vaccine, and today clinics are held at Henry Ford High School and then at Western High School. With only 23% of Detroiters vaccinated so far, Chief Public Health Officer Denise Fair says that number has to change.
And I'm encouraging everyone, get vaccinated. We also need to address fear. So fear does exist. There are Detroiters who are just saying, I'm not going to get the vaccine because I'm scared. There's others who are going to say, I'm not going to get vaccinated because I'm healthy, I'm young, and I'm invincible. But that's all wrong. We need to get vaccinated now. We're done with the excuses.
So that we can all move forward and move past this. We have complete information for you on the other neighborhood locations, the Neighborhood Vaccine Week locations that are set to open this week, and how to make an appointment. Just go to clickondetroit.com for that. There is a number that you can call. We do have one bit of bad news this week. Allocations of the Johnson & Johnson vaccine will plunge by about 88%. Michigan is scheduled to get 17,500 Johnson & Johnson single-dose vaccines this week. And according to the CDC, this is an 88% drop. So that is pretty significant compared to the nearly 148,000 doses that the state was allocated last week. Now, the drop-off in Johnson & Johnson doses is directly tied to quality control issues at a plant in Baltimore. Now, even as the state prepares for the shortage of Johnson & Johnson vaccines, the pace of vaccinations is picking up. On Saturday alone, 1.4% of the U.S. population got a COVID shot, and we're closely monitoring the Johnson & Johnson shortage, and we'll let you know if it will significantly impact vaccination efforts here in our state of Michigan. And again, if you need help on getting a vaccine, visit our website, clickondetroit.com. We are tracking appointment openings for you and clinics. It is all there on the homepage. Very, very simple to make an appointment. Well, speaking of vaccines, Governor Whitmer has been imploring the White House to send more doses of the vaccine to our state. And as of now, her requests have been outright denied. The White House did say that 160 FEMA and CDC workers will be here on the way here to Michigan to help administer doses, but no word on if any additional vaccines are being sent here to the state. In the meantime, the White House Coronavirus Task Force is holding a coronavirus briefing, and the CDC director just said the state of Michigan should bring back restrictions to try and help stop the spread.
We know that if vaccines go in arms today, we will not see an effect of those vaccines, depending on the vaccine, for somewhere between 2 to 6 weeks. So when you have an acute situation, extraordinary number of cases like we have in Michigan, the answer is not necessarily to give vaccine. In fact, we know that the vaccine will have a delayed response. The answer to that is to really close things down, to go back to our basics, to go back to where we were last spring, last summer, and to shut things down, to flatten the curve, to decrease contact with one another, to test to the extent that we have available, to contact trace. Sometimes you can't even do it at the capacity that you need. But really what we need to do in those situations is shut things down.
So you're hearing the experts recommending a shutdown. Governor Whitmer, as you just heard, is saying no to that. So far, 120 million Americans have been vaccinated for the virus, with over 72 million who have been fully vaccinated. FEMA applications for COVID-19 funeral assistance now open. And to be eligible for assistance, you have to be a U.S. citizen who's had to pay for funeral expenses after January 20th of last year. The death certificate must also indicate that the death was COVID-related. The death must have happened here in the U.S. However, the deceased person does not have to be a U.S. citizen. For more information on the requirements for this and on how to apply, just go to clickondetroit.com. Public health leaders are urging parents to get their kids caught up on their routine vaccinations after the coronavirus sparked a slowdown. Officials say vaccination rates have dropped 70% in more than half the state, putting entire communities at risk.
As things begin to open up, as we get more people vaccinated for COVID and people start traveling and moving, we will see an increased exposure to vaccine preventable diseases. And my fear is that we're going to have another pandemic take the place of what we're experiencing now.
Well, we certainly hope not. But according to the experts, catching up on vaccines prevents serious communicable diseases from spreading in our community. That includes measles, mumps, and even chickenpox. So parents should call their children's doctor to schedule an appointment for that and stay up to date. And we should note offices are taking special precautions to avoid COVID transmission. So there is an increase in safety there. All right, so to come here on Local 4 News at noon, the Derek Chauvin trial continues as there's unrest in a Minneapolis suburb sparked by the death of a black man who was shot and killed by police. Up next, to look at what a judge was asked in light of recent events and how he responded.